The magnets on Mallory Loving's fridge remind her of flight announcements, passport stamps, and foreign languages.
And it's an easy display of everywhere I've been.
Mallory has always lived life on the go. At 29, she's traveled the world. But a recent diagnosis has put a pause on her globetrotting.
So I naturally do self-checks and just touch on my boobs regularly, and back in mid-May I felt a lump in something that felt different. It shouldn't have been there.
It was right before one of her world adventures, but as soon as she got back, she went in for testing.
My mammogram came back clean. And it definitely shouldn't have been clean. So luckily I was getting an ultrasound that same day, and they saw it in the ultrasound, and they also felt my mass.
Mallory was officially diagnosed with an aggressive form of breast cancer. She's temporarily trading travel for treatment. She just completed a double mastectomy, and she'll begin chemo soon.
In a way, I'm taking this as a healing year to find adventure in new ways, just at home, having quality time, just staying still for a bit.
But she wants other people, especially young women, to be extra vigilant.
For mammograms to be the most common practice preventative for breast cancer, to detect it early is crazy to me, considering I had this huge tumor and it still came back clean.
According to a recent report by the American Cancer Society, breast cancer rates climbed 1.4% annually from 2012 to 2021 among women under 50. Dr. Kristi Funk, a leading breast cancer surgeon and the medical director of the Pink Lotus Breast Center, says a shift in our diet and lifestyle is to blame.
It's called epigenetics, as opposed to genetics that you inherit from mom or dad, like a gene mutation, BRCA, CHEK2. Epigenetics are alterations on gene signaling pathways that can affect how your cells respond inside of you. And the things that affect this are the choices you make every day.
And those choices include common things you may not consider.
Now more than ever, people under 50 are overweight, they're sedentary, they're drinking more alcohol, and they are eating more meat and dairy, so animal products, as well as environmental toxicities and elevated stress. I think all of these culminate in the increased incidence we're seeing.
And Dr. Funk says that mammograms, while definitely helpful, are not enough, especially for those at a higher risk.
I encourage you just to be breast aware. Do self-breast exams every month. See your doctor in your 20s every 3 years, in your 30s every year for a clinical breast exam. And if you should ever notice a change in the shape, contour, the look of the skin, or you feel a lump, visit your doctor.
And Mallory also has a message.
Live your life, because it's so short and you don't know what's going to happen, and anything within a switch of a day can come and completely change the course of your near future. So do the things that you want to do while you have the ability to do them. That way, when something like this happens and you have to take a year off from your quote-unquote normal life, you feel like you are at a place where you've enjoyed the things that you did want to enjoy.
A call for younger women to stay vigilant and take their health into their own hands.
Thank you for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.